Hi guys, welcome to my channel. Today we are going to discuss the direct acting cholinergics pilocarpine. Pilocarpine is a very important drug on the basis of the clinical point of view. Its clinical importance, this is a basic cholinergic agonist which is used clinically like for the treatment. We are going to discuss this in detail in this slide, so I hope you will watch this video till end. So first of all, the alkaloid pilocarpine is a tertiary amine and is stable to hydrolysis by acetylcholinesterase. So this is the important point. It cannot hydrolyze by the acetylcholinesterase enzyme. Compared with the acetylcholine and its derivatives, it is far less potent but is uncharged and can penetrate the CNS at the therapeutic doses. So it means it can produce some adverse effects which is related to the central nervous system. Pilocarpine exhibit muscarinic activity. Mostly it exhibits the muscarinic activity. So it produces the effects which are similar to the muscarinic effects and is used primarily in ophthalmology. Ophthalmology means it can produce its effects and it can use therapeutically for the treatment of the disease which is related to the eye. Pilocarpine action. Applied topically to the eye, pilocarpine produces rapid meiosis. Meiosis means contraction of the pupil and contraction of the ciliary muscles. So whenever you give the pilocarpine, it causes a contraction of the pupil and the contraction of the ciliary muscles. When the eye undergoes this meiosis, when your pupil is contracted, it experiences a spasm of accommodation. Spasm of accommodation means you cannot accommodate enough light to capture the far subjects. When the person is suffering with the spasm of accommodation, it cannot see clearly the subjects which is present at a certain distance. So only you can see at a fixed point, at a fixed distance, at a particular distance, but you cannot focus the far subjects. So the vision becomes fixed at some particular distance. That means there is a spasm of accommodation. You cannot see the far objects because of the contraction of the ciliary muscles, making it impossible to focus. Not the opposite. If there is too much spasm of accommodation, you have to give some antidote, which is atropine, and atropine is a muscarinic blocker on the eye. So this is the point. You can use pilocarpine for causing the rapid meiosis. Important point is rapid meiosis and contraction of the muscles, but because of the extra contraction of the muscles, if too much contraction of the muscles, it can cause a spasm of accommodation and there is a difficulty in watching the substances which is present at a particular distance. So you can use these you can use some kind of antidote to minimize this effect, like atropine, to oppose this effect. Okay, the next one, they are saying the pilocarpine is one of the most potent stimulators of secretions such as sweat, tears, and saliva. And this is the important point too, the tears. So it's mean these actions are important to understand, so they can use for the clinically to treat certain kind of diseases, but its use for producing these effects has been limited due to its lack of selectivity, because it can produce tears, sweating, and saliva at any receptor wherever they act. So due to the lack of selectivity, their effects are minimized. They are less used for these for producing these kind of effects. The drug is beneficial in promoting salivation in patients with xerostomia resulting from irradiation of the head and the neck. Sjogren syndrome, which is characterized by the dry mouth and the lack of tears, is treated with oral pilocarpine tablets and savimelin, and cholinergic drug that also has a drawback of being non-specific. So Xerostomia is a condition in which the less tears are produced, in which is the less salivation produced, less salivation produced, and the lack of tears. So it causes a dry mouth and the lack of tears. This condition is known as the Sjogren syndrome and xerostomia. So you can use this to enhance promoting the salivation and the tears. The very important use of the pilocarpine is in glaucoma. Pilocarpine is used to treat the glaucoma and is the drug of choice for the emergency lowering of the intraocular pressure of both open angle and the close angle glaucoma. We will discuss in detail what is the open angle and the close angle glaucoma in discussing the treatment of the glaucoma. In the later videos, where we are going to discuss the clinical importance and the clinical point of view of treating the glaucoma. So here the important thing is it we are using emergency lowering of the intraocular pressure because we have studied that it is the rapid meiosis drug that the drug produce the rapid meiosis. So we are using this for the emergency lowering of the intraocular pressure. Pilocarpine is extremely effective in opening the trabecular meshwork around the Schellman canal, causing an immediate drop in intraocular pressure as a result of increased drainage of aqueous humor. This action occurs within a few minutes, lasts 4 to 8 hours, and can be repeated. So, immediate drop in intraocular pressure as a result of increased drainage of aqueous humor. As we have studied this effect, it can cause the tears, salivation, lacrimation. So, it can enhance the flow of aqueous humor, the drainage of the aqueous humor by opening the trabecular meshwork. So when the trabecular meshwork open and the drainage of the aqueous humor occur, then ultimately causing the lowering of the intraocular pressure. This section occurs within a few minutes, lasts 4 to 8 hours, and can be repeated. This is the very important note. Topical carbonic anhydrase inhibitors such as dorzolamide and beta-adrenergic blockers such as timolol are effective in treating glaucoma but are not used for the emergency lowering of intraocular pressure. It means if the patient is suffering with glaucoma and there is high level of intraocular pressure present, so for the emergency lowering, we are using pilocarpine, but for the continuous treatment of the glaucoma, we are using carbonic anhydrase inhibitors or the adrenergic blockers are the drug of choice. So this is the clinically important point for the drug of choice. If you need the emergency lowering, then you are using the preferred drug is pilocarpine, but for the treatment, the preferred drug is adrenergic blockers or the carbonic anhydrase for effective treatment. For the effective treatment, these two, and for the emergency lowering, you can use glaucoma. The mitotic action of the pilocarpine is also useful in reversing the mydrosis due to the atropine. So they both are antidote of each other. If there is a mitotic action of the pilocarpine, if there is so much mydrosis occur, like dilatation of the pupil occur due to the atropine, you can give the pilocarpine to oppose this effect. I wanna show you this thing in a diagram. This one. This is the Lippincott page from where I prepared these slides. So you can see here I treated with the pilocarpine. When you give the pilocarpine, the pupil is constricted, the pupil is contracted. This is called the meiosis, contraction of the pupil. When you give the pilocarpine, which is the cholinergic agonist, and the pupil is contracted. This is the untreated eye, which is untreated. When you give the pilocarpine, it becomes like this, and when you give the atropine, it becomes like this. Like you can see the dilatation of the pupil with the atropine, that is mydrosis. on iris and ciliary muscles of the eye. So this is the contraction of the ciliary muscle. That's why the when we can the pilocarpine contraction ciliary muscles occur. That's where the meiosis happen, and the give atrophy and dilatation of the ciliary muscles occur. That's why the dilation occur. So here the adverse effects of the pilocarpine. Pilocarpine can cause blurred vision, night blindness, and the brow ache. So you can see the blurred vision due to the spasm of accommodation. When there is a spasm of accommodation, it means it can cause the blurred vision. Poisoning with this agent is characterized by exaggeration of various parasympathetic effects, including profuse sweating, diaphoresis, and salivation. Because we have studied its action is salivation, tearing, lacrimations. So if there is a too much of these effects, that causes the poisoning. So diaphoresis is the enhanced release of the sweat. So profuse sweating diaphoresis occur due to the pilocarpine. The effects are similar to those produced by consumption of mushrooms of the genus Inocybe. So when the genus Inocybe, it is a kind of mushroom you have taken, you have consumed this kind of mushroom, you are suffering with too much sweating, and this sweating is due to the cholinergic effects, cholinergic activity of the cholinergic activity produced by these mushrooms, uh, and the pilocarpine mimics this action. So you can say the consumption of mushroom the genus Inocybe causes too much, can cause a diaphoresis, profuse sweating. Parenteral atropine at doses that can cross the blood-brain barrier is administered to counteract the toxicity of the pilocarpine. If there is any toxicity happen during the pilocarpine, you have to give the parenteral atropine, which is the antidote. So if the genus Inocybe mushroom you consumed and you are suffering with the diaphoresis, then you can give the atropine too. This is also the clinical important point for the cholinergic agonist. So we have discussed the direct acting cholinergics up till now. In the next video, we will discuss indirect acting cholinergics. So I hope you like my video. Kindly like my channel and subscribe my channel. Never forget to click on the bell button.